I've been housebound and almost completely bedbound now for about 6 years. About 4 years ago, I also became unable to use the phone as well. I haven't been able to just ring a friend for a chat for 4 years.
31-year-old Jodie Bassett is too unwell to meet with me. Instead, she's recorded her thoughts at home over a few days. Jodie has myalgic encephalomyelitis, or ME.
Damage to a certain part of the brain caused by a virus is essentially what ME is. It's an infectious neurological disease that's been around for centuries. Every bodily system is affected in some way.
Being housebound and bedridden isn't all that ME is about, but this effect of the condition has led to frustration when it comes to diagnosis. Back in 1988, the US Centre for Disease Control came up with the term chronic fatigue syndrome, or CFS, in an attempt to define what they considered to be fatigue illnesses. In the years since, the term CFS replaced ME, a recognised physical illness. Jodie Bassett argues this decision was political, aimed at limiting medical insurance payouts. ME, along with other illnesses, could now fall under the CFS umbrella and be explained as psychiatric or behavioural. Associations in Australia now refer to the illness as ME-CFS, but sufferers' support groups and doctors say there's been years of misunderstanding, misdiagnosis and poor treatment.
I think there's a lot of ignorance out there. I think the information that's generally given to doctors is inadequate, and I don't think they do enough training in this.
Dr. Richard Schloeffel says he sees around 2,500 patients who have symptoms of ME or CFS.
What do you think are the common misconceptions about it?
The greatest one is that this is not a psychiatric or psychological disorder. This is a physical disorder that might have mental symptoms, but it definitely doesn't have a psychological basis. It's frustration, it's not depression. So if we call it a depressive illness, we're actually doing them a disservice. Unfortunately, the current protocols that have been distributed throughout Australia indicate that this is a mental disorder, and I think that's wrong.
22-year-old Helen James's condition is mild compared to Jodie Bassett's. Even still, just doing something like this interview can take days to recover from. Noise and light sensitivity, headaches, joint and muscle pain, and irritable bowel all take their toll. And Helen knows all about the frustration of misdiagnosis.
It took me about a year to get a diagnosis, seeing doctors jumping around.
How many doctors did you have to see?
So about 4 GPs, seen a couple of specialists on top of that.
And what were they saying?
Depression. I was trialled on a couple of different headache tablets. But mostly it was, I don't know what's wrong with you. I don't know that there's anything wrong.
In regards to research here, Simon Wolesworth is the chair of ME-CFS Australia.
If you analyse the research funding over the last 20-25 years into this area of health, it's something like 90% biased towards psychiatrists carrying out their research into what we call the secondary flow-on impacts of the illness.
So why is all that research going into psychiatric?
Well, we have been asking that question of government authorities for at least the last 10 years.
Simon Molesworth also wants doctors' guidelines changed so ME or CFS can be better diagnosed.
The Canadian guidelines is state-of-the-art.
What's different about them?
A clear, unambiguous recognition that the illness is a biophysical illness. We keep asking government why they do not push the medical organisations in this country to adopt the Canadian guidelines. And the CFS-ME community in Australia and our National Association is determined to have the Canadian guidelines looked on favourably in this country.
So if there's confusion about this in the medical world, what can the friends and family of an estimated 150,000 sufferers do?
Look, the biggest thing that family and friends can do primarily is acceptance. They need to be accepted that they're sick. They need to be thoroughly supported in every way possible to make sure they've got nutrition, make sure they're getting plenty of sleep, that the household adjusts. Not only we need education and research, but we need the public to be educated and families to be educated about what we're dealing with.
What means the most to you as far as support goes?
That my friends and my family have been there, that they believe me, that they try to understand. I want to be out there. I want to be doing what I love. I want to be seeing my friends regularly. I don't want to have to think about all the consequences of every little action I do. I want a normal life.